Welcome to Virtual Reality Exposure Therapy for the treatment of post-traumatic stress disorder. I'm your presenter, Joy Campbell. Post-traumatic stress disorder affects veterans from the Vietnam era to today's conflicts in Iraq and Afghanistan. There has been much research done about the treatment of virtual reality exposure therapy to decrease the symptom severity of post-traumatic stress. Random control trials conducted by McLeod, Anderson, Meyer-Broker, and others has demonstrated that virtual reality exposure therapy is an effective treatment in decreasing the symptom severity of post-traumatic stress. The purpose of my project is to conduct a study that will support the research already done and to add to that research. I propose to conduct a study at the Ireland Army Community Hospital Behavioral Health Clinic. Volunteers will come from participants that's in the PTSD treatment group. I, as the primary facilitator, investigator, will inform the subjects of the process that will be involved, the purpose of the study, and the risk and benefits that they may receive. The risk involved in this study would be that their symptoms might increase, although steps will be taken to minimize this risk. The benefit would be that their symptoms would improve. Once informed consent is obtained, the participants will complete baseline assessments of the PTSD Clinically Administered Assessment, CAPS, and the PTSD Symptom Scale Self-Report, PSS-SR. And these assessments will also be completed at the end of the 10 weeks treatment, as well as a 3-month and 6-month interval. The expected outcome is that the scores will decrease by at least 30%, which would indicate a significant improvement in symptom severity. Volunteers should be pretty easy to come by, as VRET simulates a video game and recreates the soldier's traumatic experience. After 4 weeks of treatment, I got ahead of myself. Girardi's case study demonstrates how VRET helped one active duty service member. The 29-year-old service member was experiencing symptoms of avoidance and irritability. After 4 weeks of virtual reality exposure therapy treatment, his CAP scores decreased by 56%, and he found himself enjoying being around his family and dwelling less on the traumatic experience he had had. Virtual reality exposure therapy has the evidence-based research to support being used for the treatment of PTSD in the military. Although more research is needed before it becomes the standard of care, as advanced practice registered nurses, we have a responsibility to seek out the information that can best provide the treatment. As advanced practice registered nurses, we have a responsibility to seek out the evidence that best supports the treatments that are going to produce the best outcomes for our patients. Virtual reality exposure therapy has the research to demonstrate that it does produce great outcomes in military members suffering from post-traumatic stress. Thank you.